So tonight I'm going to be talking about a very important topic, overactive bladder, that doesn't get quite as much press as perhaps it deserves because it can be a little bit embarrassing. And so I'm here to explain what it is, possible treatments, and if you know anyone who has it or you have it, how to potentially improve your quality of life if you do have it. So I don't think I need to go into too much detail because Reverend Horace had such kind words, but just briefly, I'm a urologist, which means I take care of the bladder, the prostate, the kidneys, and in men, the reproductive organs. My practice specializes in urinary dysfunction, enlarged prostate, men's health. I see a lot of men with erectile dysfunction, and of course, urologic oncology as well. So I treat prostate cancer, kidney cancer, bladder cancer, et cetera. I work for Advanced Urology. So we're a large urology group that covers most of Atlanta. I see patients in several offices in the Midtown Buckhead area, Sandy Springs, and Johns Creek. So I'm a bit of a road warrior during the week. So what is overactive bladder? Overactive bladder is not a disease per se, like diabetes or high cholesterol, but it's a group of symptoms. And so the common symptoms associated with this condition would be urgency. And this means that you have a sense of urge, like it comes out of nowhere and you feel like you have to go to the restroom very quickly. Frequency, so this would be going very often throughout the day. Now, it can be normal to go up to 7 or 8 times during the course of the day, but any more than that is very bothersome and can really affect quality of life. Now, the next one is a big one and can really affect quality of life for many patients, and this is called nocturia. This means the act of getting up in the middle of the night to use the restroom. It's unfortunately, it's many Americans are affected by this specific symptom, and it can lead to being tired the next day. It's associated with falling at night as people get older, and so it's a big deal. And then there's urge incontinence, and what this means is that the urge to go strikes so quickly that you may not be able to make it to the bathroom. And so this is where patients may have to wear, Depends, pads, adult diapers, that sort of thing, just to protect them from, this urge that strikes so quickly. A little bit more about overactive bladder. It's extremely common. Over 33 million Americans are affected by overactive bladder. A common misconception is that it only affects women. Now, it is more common in women, about twice as common, but men can have it too. What complicates things with men is that the prostate gland often can produce symptoms similar to overactive bladder. And so as a urologist, my day is often spent helping patients figure out whether their symptoms are due to overactive bladder or the prostate gland, and sometimes those symptoms overlap. But men absolutely can get overactive bladder, even if the prostate is not to blame. And again, about 1 in 5, sometimes some statistics say 1 in 4 patients at some time in their life may have overactive bladder. So it's extremely common. Just to give some perspective, if you look at the prevalence, meaning the number of people that are affected by it, of different conditions in the US, overactive bladder is actually more common than things like asthma, diabetes, osteoporosis, Alzheimer's disease. And so you absolutely may know someone who has, or you may have overactive bladder. People just aren't shouting it from the rooftops, but it is a very common condition. And it also increases with age. And so as you get older, and I will explain in a little bit more detail why this happens, but as you get older, the prevalence of overactive bladder does increase. In men, sometimes that is due to the prostate gland. But in women and in men as well, there is sort of a different mechanism that I'm going to explain shortly. So what is overactive bladder? Another way to think of it is in the picture on the left, this bladder, the muscle of the bladder doesn't squeeze and contract until the bladder is full. That's how things should work. On the right side, the bladder is only partially full. There's only a little bit of urine in it, but what's called the detrusor muscle, which just means that's the specialized name for the muscle in the bladder. The detrusor muscle starts to contract before the bladder is full. And so you have this urgency to go because your bladder muscle is literally squeezing, saying, I gotta go, before it truly is full. Now, why does this happen? So I created a few different graphics that may help illustrate why this all happens. So when you're a baby, all babies are born with an overactive bladder. That's why they go all the time. And so when their bladder fills up with a little bit of urine, the next thing you know, that detrusor muscle is contracting to empty out the urine. So babies are going constantly throughout the day. That's how their bladder is created and designed. That's what the bladder does. As you get older and you become potty trained, the brain starts to send a signal to the bladder that says, hold on, wait a minute. Don't feel that urge. Don't contract the detrusor muscle until you're full. And so that's why adults, once they're potty trained, they don't feel that urge. They don't have to go all the time like a baby does. Now, what happens with overactive bladder? The bladder starts to fill, the brain starts to send the signal, but it never quite gets there. And so as people get older, there's not even a specific reason why, but that signal gets disrupted or weakened. And so the bladder reverts back to just how it was created. And so it starts to squeeze, the detrusor muscle contracts, and you feel the urge to go. The bladder becomes very sensitive without that signal from the bladder. Now, the good news is that just because the brain stops sending the signal to the bladder, there are a number of treatments that exist that can reintroduce that signal. And so that's sort of the underlying treatment goal with overactive bladder treatments, is to resend a signal to the bladder to calm it down like the brain is supposed to be doing. So why is this important? I know obviously these symptoms can be annoying, but a little bit more than that. Overactive bladder impairs quality of life. It reduces quality of sleep, certainly getting up in the middle of the night, sometimes multiple times. I have patients who sometimes they get up 5-6 times, and that's a difficult way to live. Poor sleep quality leads to being tired during the day. It can be harder to get tasks done during the day if you're always tired. And as I alluded to earlier, a number of falls actually at night can be attributed to overactive bladder. You wake up in the middle of the night, you rush to the restroom, it's dark, and the next thing you know, you trip. And so a number of falls, particularly in the older population, can be directly attributed to overactive bladder, which is another reason why it's important to treat this condition. Reduced physical or social activity. I have a fair amount of patients who, before we were able to help their condition, wouldn't even go out in public unless it was absolutely mandatory. Their only trips in public would be the grocery store, perhaps an occasional gathering, but otherwise they did everything they could not to be in public because they had to rush to the restroom constantly. Overactive bladder can be associated with depression, especially if symptoms are more severe. And the final statistic doesn't necessarily have to be true, because there's more awareness about this condition, we can change this statistic. But about half of individuals with overactive bladder and incontinence in particular never actually consult the healthcare providers because a lot of people attribute it to, well, it's just a part of getting older. But fortunately, there are a number of treatments to help this condition. Now, I went through sort of why it happens, meaning the brain is supposed to send a signal to the bladder and that signal gets weakened. Occasionally, there are other conditions that would disrupt that signal. Most of the time, there's not a specific underlying condition, but sometimes there are conditions, things like diabetes, bladder abnormalities like a kidney stone. Neurologic conditions can disrupt that signal between the nervous system and the bladder. For example, multiple sclerosis. Bladder obstruction, or in men, an enlarged prostate, sometimes on its own will cause an overactive bladder. Diet and consumption of certain liquids such as alcohol and caffeine can exacerbate or make symptoms worse of an underlying overactive bladder. As you get older, this is associated with decline in cognitive function is linked to overactive bladder, infections, depression, and anxiety. So there are a number of patients of mine who their symptoms flare up or get worse during very stressful periods. And there's definitely a mechanistic reason for that. I'm not going to go into all the details, but it's very real, where patients who are under a lot of stress and anxiety have worse urinary symptoms. And of course, any neurologic trauma or damage to the anatomy can also cause overactive bladder. So now, on a happier note, let's talk a little bit more about some of the treatments. How can we actually address some of these problems? So the first step is behavioral or lifestyle intervention. So these are things that we can just change day to day. For women, Kegel exercises, and men too, to a lesser degree, but this is a little bit more important in women, are doing what are called Kegel exercises. And this is strengthening the pelvic floor muscles. And there are a number of exercises to do this, and the exact instructions, you could go on Google and find out exactly how to do this, but you're basically just trying to strengthen the pelvic muscles. Avoiding food and drink irritants. So what's interesting is there are a number of foods and chemicals that can irritate the bladder. And as you get older, sometimes the bladder is more sensitive than when you're 20 years old. And so caffeine, spicy foods, alcohol, for some people, chocolate, there's a number of different things that can exacerbate overactive bladder symptoms. Reduction of weight sometimes is helpful in these situations. And then timed visits to the toilet to prevent urge. So, people who have overactive bladder do better with a regular schedule. An overactive bladder patient doesn't do well if they hold their urine for a long period of time and the bladder gets full. That's going to make the symptoms worse. And so scheduled visits to the restroom. And then, of course, as I mentioned earlier, emotional stressors certainly can make things worse. So finding someone who can help address these issues is very important. Now, obviously the diet, lifestyle factors are very important, but for some people, their symptoms are more severe, and so there are other treatments. There are a number of medications, and the way that these work is basically reintroducing a signal to the bladder that says, calm down. And so the number of medications that I have listed there, they all act on different pathways. I'm not going to go into all those details, but basically they just try to calm down the bladder. And for a lot of patients, taking a medication provides a significant relief in those sort of symptoms. Medications don't work for everyone. And for the most severe cases, I have plenty of patients who, literally their life is ruled and controlled by overactive bladder, but it doesn't have to be. And so there are more advanced treatments for the most severe cases. There's something called sacral nerve stimulation. And what this is essentially a pacemaker that is put in under the skin in the tailbone area, connected to some wires that go to the nerves in the tailbone area. And it acts like your brain would, where it sends a signal to the nerves that go to your bladder to tell it to calm down. Again, it's the same concept over and over. We're just trying to calm down, send a signal to the bladder to calm down. And so this sacral nerve stimulation regulates the bladder and allows it to behave normally. And it works remarkably well. So these are the most severe cases, but yet about 85% of cases still have a significant improvement. So even towards the end of the road patients, there are options that work very well. It's not a Band-Aid fix. So this is actually a permanent implantable pacemaker, and it's safe, MRI compatible, and it works very well for a lot of my patients, and it's covered by insurance.
Dr. Farber.
Yes.
So in a sense, this is really working like the brain would have worked earlier to send a message to the bladder to hold off.
That's exactly right. And the brain is connected to the bladder by the spinal cord and different nerve roots. And what this is doing is stimulating the third sacral nerve in particular. And so it's literally doing what the brain may not be able to do as people get older. So it's a remarkable, device, and it works really well for a lot of patients. Interestingly, we don't go directly into putting that in. We usually do a test first. I don't have a slide on that, but patients come in and almost like an IV in the back where we just put the wires. We don't actually put the pacemaker in. We put the wires first, and they have a little box that they wear for about 3 days as a test. And so before jumping to doing something permanent, they just do a test for 3 days, sometimes 5 days. And in those 3 to 5 days, a lot of patients will say, wow, that was the first time I got a good night's sleep in years. And so we know they're a good candidate for getting the actual device. On the flip side of things, if they don't respond to the test, well, then we don't have to proceed with doing this procedure. And so there's a nice way to go about doing it. There's also Botox for the bladder. Now, most people are aware of Botox in the plastic surgery world, where you may get Botox in the forehead to prevent wrinkles. But how it works is it calms down or paralyzes, so to speak, muscles temporarily, and it tells them to calm down. Well, you're starting to get the sense that the bladder, needs to do the same thing. And so the way it works is it's a procedure under a light sedation. I go in with a camera in the bladder and use a specialized needle, and I inject Botox throughout the bladder into that detrusor muscle that's overactive. And it works remarkably well to, again, calm down the bladder so they're not getting this sense of urgency, irritability, etc., and allows the bladder to return to normal function. About 70% of women who did not improve with medication had significant improvement with Botox. The downside is just like Botox in the forehead, it wears off. And so patients have to come back every 6 months or so for a Botox injection. Not everybody, wants or is a good candidate for the pacemaker. And so Botox is just an alternative therapy that works very well for these more severe cases. So it's not just for wrinkles, it's also for the bladder. And so that's, a pretty broad overview of overactive bladder, what it is, and different treatments. So I'd be happy to, go into any more detail about any of these if people have questions, or be happy to explain any other questions.